Hello, nurses. Welcome to the new Nurse Orientation Podcast. I am excited that you decided to join our team. And really, every single one of you is starting a unique journey with the best hospital in the country. My name is Andrew Williams, and I aim to orient you to the importance of nursing sensitivity quality indicators, NSQIs, and how they impact the quality of care, improve patient satisfaction, and establish evidence based practices. Over the next 10 minutes, I will provide you with the framework of how you as an individual can work collaboratively with others to influence patient safety, patient care outcomes, and organizational performance reports. You will learn what NQIs are, the process used to collect and disseminate data. You will also understand how your role and daily tasks contributes to the process and impacts the organizational patient safety, outcome, and performance report. The National Data Nursing Quality Indicators (NDNQIs) is a program developed by the American Nursing Associations in 1998. It is used to assess and analyze nursing quality data retrieved from over 2,000 hospitals across the United States and to generate performance report benchmarking against national, regional, and state performance of other hospitals. Health Link N-D dat. The performance report are generated through Pressgany, is a company that sends out quarterly and annual reports, and it depends on the particular NSQI being evaluated. Nurse sensitivity quality indicators (NSQI) are measures impacted by the quality of nursing care. These measures are directly influenced by the triage of Dr. Abvides Donanbirian QA Quality Assessment Framework, abbreviated DQAFs. It's broken down into three categories: organizational structures, which include nursing hours per day, level of education and certification of a nurse, turnover, and skill mix. Second category is processes, patient assessment, the interventions for patients, and the nurse job satisfaction. And the third classification is the patient outcome, which correlates with the quality and the quantity of care that is provided. Edward et al. In 2020. The NDNQI has multiple NSQIs to choose from for an healthcare setting. I have decided to focus on the NSQI for pressure ulcer prevalence. Due to the impact of on the organization performance report, patient safety and outcome. It is important to monitor the NSQI's score for pressure ulcer prevalence because it provides the department leaders with insight into how the quality of care over the last 3 months impact patient safety and outcome. New nurses must be familiar with the NSQI for pressure ulcer prevalence to help them understand how the quality of care they provide impact patient safety and patient care outcomes. In 2019 article, Catlin and Kornbusch said that nurses' contribution to the quality of care is invaluable for patient safety and outcome. The NSQIs reveal areas of strength and weaknesses, determines where improvement is necessary, and which of the three DQAFs categories the improvements fall under. The interdisciplinary team role. Now, data collection is a team effort and starts with the NDNQI's coordinator. The team includes the coordinator, unit leaders, nurses on the floor, IT engineer, health information managers, HR personnel, and other professionals. The NDNQI's coordinator is the facility point of contact person who works with the NDNQI liaison to maintain standards, update and collection process, submission of data, and updates us with any changes. The coordinator makes sure that the collected data is in alignment with NSQI's definition for each indicator and is submitted every 3 months. The coordinator and other trained interdisciplinary team members monitor the integrity of the collected information. Nurses contribute to the process by accurately documenting the patient care they provide and the coordination with care team members. The nurse adhere to a standardized data collection practice based on established guidelines using surveys, data mining, and interviews. A nurse informatist on the team does data mining on the prevalence of pressure ulcers in our unit. The number of patients on the unit with pressure ulcers, how many pressure ulcers a patient has, the anatomic location of pressure ulcers, and ulcers acquired before being admitted to the unit. The quality of the data submitted to the NSQI and the performance reported generated from the data can give the unit leader insight into how well the unit matches up with comparable units. The interview I had with the NSQI coordinator on my facility left me with a greater understanding of how the process of collecting data works and how the contribution from everyone affects the integrity of the information collected. As a result of that interview, I am now more diligent with my patient care documentation and how I interact with the patients as well as other members of the care team. I had to overcome some challenges when the collection process was initially introduced to me. I had to overcome comfort with navigating the electronic medical records. I didn't know the significance of accurate, precise documentation on the integrity of the data collected, nor was I focused on how nurse to nurse or nurse to patient interaction affects quality of care. However, I have become much more comfortable and efficient with my contribution to the process and our NSQI outcome. Bedside nurses' role in entering information is critical to the quality of the data mined. The information entered must be timely, accurate, and reflects the details necessary to capture the care provided and its outcomes. Documentation is done in the electronic medical record or is scanned into the patient record at the point of care. This process has been very effective because the charting is done in real time and is immediately accessible to the patient or staff members associated with the patient care. The impact of patient care technology on desired outcome. Organizations uses NSQIs to help improve the quality of care provided and enhance patient safety, patient care outcomes, and performance report. Many healthcare stakeholders monitor NSQIs because it brings awareness of how well a unit is doing and helps justify decisions related to the structure and process of nursing care. Support of the performance report for the NSQIs for pressure ulcer is not up to our par. Suppose, right? Just suppose that the report from NSQI is not up to par. Leadership can implement evidence-based practice to address deficiency of structure or process with education on the pressure ulcer prevention or management, or adjusting the number of staff and the staff mix. This was reported by Bell 2020. The outcome from that intervention can be assessed based on the reduction of the unit acquired pressure ulcers, staff actively following measures to prevent the bed sores, charge nurses holding nurse accountable to complete each task on time, nurse educators ensuring staff competencies, and unit leaders accountability for adequate staffing. Pressure ulcers lead to complications such as increased length of stay, the risk of bone or tissue infection, and even sepsis. Floyd et al. In 2021 reported that other older adults and patients with immobility have the highest susceptibility to pressure ulcers. The authors confirmed that care bundles with 3 or more evidence-based practice and early Braden scale assessments could significantly reduce hospital-acquired pressure ulcers. Accurate documentation from the nursing staff can help identify the deficiencies in our care plans and processes that contribute to pressure ulcer prevalence. NSQI performance reports are downloaded every quarter and disseminated to the department at the department level to unit leaders. They see and share the information with staff on how care performed on the unit compares to benchmark. The department leaders can advocate for changes using the information to justify staffing needs, evaluate performance improvement plans, and implement education and competency programs. Nurse leaders learn how well their unit matches up with other departments, and nurses can assess how their contribution influences patient care. How does NSQI establish evidence-based guidelines? Now, the NSQI reports reveals industry standards that may be used as evidence to negotiate for adjustment in staff to patient ratio, the skill mix based on the information, the demographic of similar units and patient population. Truinman et al. In 2021, in a systemic review, examined the association between nursing sensitivity, quality outcomes, and the type of nursing staff. The author reported that inefficient skill mix negatively influenced more than 61% of NSQIs and the result of patient care. Nursing leaders' awareness that their organization NSQI on pressure ulcer prevalence helps to identify deficiencies and justification for intervention to improve the structure of the quality of care. Authors such as Floyd et al. Recognizes that using evidence-based strategies vastly improved the prevention and treatment of pressure ulcers in 2021. Other authors also associated the impact of evidence-based intervention on patient care. Swin et al. In 2017 reported that a collaborative approach to pressure ulcer prevalence had a tremendous effect on preventing and managing pressure ulcers. The authors found that support and a change of understanding enable individual change actions through nurses' reflection on their performance concerning pressure ulcers. Swin et al. Also explained that the care team needs a common perception of preventive measures, access to the appropriate tools, and facilitators' support to optimize the care outcome. 2017. In conclusion, this was a lot of information just presented to you. You will always have a nurse on the floor that you can ask for guidance. The most vital point to remember is that every task has an impact, and that impact is dependent on how well you document the patient care. You are the building blocks of each outcome. The more diligent you are at your role and documentation, the better results we'll have. You have the right structure and use the best processes, so let us make the best outcomes. Thank you.